Good evening, my name is Drake Murphy. I am a graduate speech language pathology student at Hampton University, and this is aphasia support. Jenny from the block asks, what is aphasia? These are big words for Elmo. So Jenny, aphasia is an acquired language disorder that can be acquired through things like traumatic brain injuries like car accidents or through cerebral vascular attacks or strokes. So when you have aphasia, you have severe or moderate or even mild language deficits that deal with oral expression and language comprehension. So there are 8 different aphasias, 4 fluent and 4 non-fluent. The 4 fluent aphasias include Wernicke's aphasia, conduction aphasia, transcortical sensory aphasia, and anomic aphasia. Where we have our non-fluent aphasias, there are Broca's aphasia, transcortical mixed aphasia, global aphasia, and the topic of discussion for today's video, transcortical motor aphasia. Benny Hanna 605 asks, can you explain more about what transcortical motor aphasia is? I'm learning about this in class right now and I'm so stuck on the concept of it. So Benny Hanna, transcortical motor aphasia is a non-fluent aphasia like we established before, and it deals primarily with lesions that are subcortical and located on the anterior horn of the left lateral ventricle. And this aphasia is important because it is located in the main anterior watershed area, which sits right between 2 main arteries of the brain, the anterior and the middle cerebral artery. So this aphasia is one of the first to be affected during a stroke because of how far away it sits on the brain. It sits on the border of the brain, kind of. It was actually nicknamed the border zone aphasia by Benson back in 1979 because of how far away the lesions sit on the brain during MRI scans. So a good way to think about this concept of transcortical motor aphasia is to think about when you're cold, your fingers and your toes are the first things to go cold and numb because of how far away they sit away from the main circulatory system, which is the heart. Carrie from Around the Way asks, so when you're looking at an MRI scan of a patient with transcortical motor aphasia, will you see the lesions in the same area each time you look at a different MRI scan? So Carrie, that's actually a good question. So no, a lot of patients have some variation on where the lesions may lie in the frontal lobe of their brain with transcortical motor aphasia. So with some patients, you may see more lesions on the anterior cerebral artery, which deals with voluntary movement. So when you have the lesions there, you will have a lot of lacking in voluntary movements. Or when you have lesions on the middle cerebral artery, you'll see a lot more motor speech deficits. But then you'll also have lesions that affect both arteries. So you'll see a combination of those two concepts, motor speech deficits and lacking of voluntary speech. Blake Lively asks, can we get a visual of what the arteries on the brain look like? As I hear it talking about these transcortical motor aphasia, but I'm kind of having trouble picturing where the watershed area is and where the arteries of the brain are. So that's actually a great question because I have a diagram right here for you to view. So right here we have our brain. In color, you'll see the different arteries of the brain. So this region right here is going to be in the orange, that is the anterior cerebral artery. Then you'll have the red, that is the middle cerebral artery or the artery of stroke. And this middle cerebral artery is the largest artery that covers our brain. Then down here in the blue, you'll have the posterior cerebral artery. So in this area right here, you'll see that there is the anterior watershed area. So that is in the purple, and this is where the main area for the transcortical motor stroke will take place. Another diagram we have here is a coronal cut of the brain. So from ear to ear, you'll see right here we have the anterior watershed area, but also down here we have the posterior watershed area. So you can see visually how the watershed areas are on the border of the brain. They sit between the main arteries of the brain. So right here we have the MCA, PCA watershed area. And right here, our area of choice is the anterior cerebral artery and the middle cerebral artery where our transcortical motor aphasia is going to take place. Angelina Jolie asks, so what are some symptoms of transcortical motor aphasia? So when you're thinking about the symptoms of transcortical motor aphasia, it is important to note that it is a non-fluent aphasia. So when you're looking at these symptoms, you can see that they also coincide with a lot of other non-fluent aphasia symptoms. But one thing that stands out a lot with transcortical motor aphasia is that repetition is intact. So you will see that with a lot of the transcortical aphasias, like transcortical sensory aphasia. So repetition is in fact intact, but also so is auditory comprehension. But you also have other categories that are intact, like confrontation naming, one-word responses, which is completely easy to them, and then also some mild to moderate articulatory sounds. But now when you start to talk about the deficits that come with transcortical motor aphasia, you'll see that these are the ones that sort of coincide with these other non-fluent aphasias. So you'll see a lot of phonemic paraphasias, or substituting one sound for another sound within the same word. You'll see some syntactic errors or some grammar rules that are being misconstrued. You see some perseverations, or in other words, sticking to a topic or sticking to a behavior that has already been moved on from the conversation. And difficulty initiating and responding to conversations. This is a very hard thing for transcortical motor aphasia patients, but also you also see them struggling with open-ended questions. So a lot of times transcortical motor aphasia patients, they don't do well with responses that require them to expand on their thoughts, so like abstract thoughts. So you'll see that a lot with transcortical motor aphasia patients. But you'll also see a lot of echolalia as well. So with echolalia, these TMA or transcortical motor aphasia patients, they're easily understood, but they do lack the intonation and the prosody that non-aphasia patients have. So these transcortical motor aphasia patients, they're aware of their echolalia, but they are unable to suppress the behavior. Tay from Around the Way asked, how would you evaluate someone with transcortical motor aphasia? What and how does it differ from the other aphasias? So a lot of times, the evaluation process for a transcortical motor aphasia patient will look exactly the same as someone with Wernicke's aphasia or anomic aphasia. So the evaluation process, typically you see a lot of aphasia patients in outpatient centers, rehab centers, home health, long-term care facilities, and they're all usually referred to by their primary care provider or by someone who did imaging testing on them, like MRIs or CTs, and they're referred to an SLP or a speech therapist at these facilities. And as the SLP, you will really want to first read past notes by their primary care physician or by other professionals that they've seen for their condition. And then you want to conduct a client or caregiver interview so you can get a better idea of what their activities of daily living or instrumental activities of daily living look like, and if they need any independence with essential things like eating, sleeping, dressing themselves, brushing their teeth, or so on and so forth. So once you have completed your client or caregiver interview, you kind of have an idea of what assessment you want to do now on the client. So a lot of popular aphasia tests include the Western Aphasia Battery or the Comprehensive Aphasia Test. A lot of these tests are pretty lengthy in time, and if you are in like an outpatient center where clients are back to back, you really want to either choose certain parts of the assessment you want to do, or you can choose an assessment that is more time friendly in settings like outpatient or acute care. Raven Simone asks, I currently have a transcortical motor aphasia patient with me that I see twice a week, and I have never operated on transcortical motor aphasia patients before. What are some treatment approaches that I could use in my sessions? So there are a lot of things that you can do to help a transcortical motor aphasia during speech therapy. So a lot of things I've done in the past with my transcortical motor aphasics is optimizing their speech output and initiation of conversations, increasing their utterance length, decreasing their paraphasic accounts of output, and increasing their intonation at the word level and the sentence level. So these areas of concern, they target all areas variously, but functionally they target their activities of daily living and their instrumental activities of daily living activities while during conversation. So our last question of the night comes from Frosty the Snowman, and he asks, since I'm a speech therapist myself, and I've never had my own transcortical motor aphasia patient, what are some other objectives that they can focus on while in speech therapy? So being that I'm in an outpatient center myself, a lot of aphasia patients we see really want to get back into having social conversations and getting back into their activities that they enjoyed before their incident. So a lot of times you really want to focus on the pragmatic approach when it comes to speech production, but also, again, it's a stroke and they had acquired language disorder, so that comes with some cognitive deficits as well. So you want to really target on some cognitive linguistic activities as well. But also some adjacent activities you could focus on, or objectives you could focus on, are motor speech production and language. Again, this is an acquired language disorder, so a lot of their syntactic errors could be wrong, their mean length of utterance could be reduced, a plethora of things. So taking in a multifactorial approach when it comes to transcortical motor aphasia is definitely necessary. So I hope you learned something a little more about transcortical motor aphasia today, and I hope to see you next time on aphasia support.